Open meeting or virtual meeting statement pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law, general law, chapter 30A, subsection 18, and the governor's March 15th, 2020 order imposing strict limitations on the number of people that may gather in one place. This, the meeting of the Hubbardston Board of Health will be conducted via remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation by members of the public and or parties with a right and or requirement to attend this meeting can be found at www.hubbardstonma.us. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time via technological means. In the event that we are unable to do so, despite best efforts, we will post on the town's website an audio or video recording, transcript, or other comprehensive record of proceedings as soon as possible.
All right. Starting at the top of the agenda, review the minutes from the last meeting, which are at the bottom of the agenda, following a couple of blank pages. Did everybody have a chance to read the minutes from the last?
I read them.
I did too. I have no changes. Anyone else, Ben or Judy?
Fine.
Okay, so now make a motion that we approve the minutes as written.
I'll second. And Ben? I saw your mouth say aye, but I couldn't hear you because you're muted. Judy? Judy, how about you?
What? Oh, I'm fine.
So you're an aye, Kathy?
Bye.
Yes,
All right. And Keith's an aye.
I thought you was trying to get Vinny to unmute
I
there.
know. You're still muted, Ben. You can hit the blue icon with the white video camera, and then the bottom left, you got to click your unmute.
How's
There you
that?
go. Much
Okay.
better.
All righty.
Now we can hear you.
Very well. I said yes to the minutes, by the way.
I could see. I read your lips. I saw the
that's what
eye.
it meant. I didn't realize I was muted. Well,
All right. All right.
Shut
Moving
it.
on.
yes.
It's always fun. All right. Anything on the COVID-19 update, Mallory?
I don't have anything really new and exciting. As of this morning, we had 8 positive cases and 4 probable cases. I don't know if you're finding this too, Judy, but our tests are coming in slower and slower. There's a big lag time in between.
Yeah. Yeah, they said this morning that they were getting like 3,000 reports daily now.
Yeah.
So the system is a little bit, slow. And then we have the new quarantine regulations that came out last Thursday too. So they had a meeting this morning trying to explain it all. So I got it. I hope. But basically, if the quarantine is now down to if you've been exposed or if you're positive and asymptomatic, we're down to like about 10 days instead of 14. But there's a catch. There's always a catch. The catch is that between day 8 and day 10 of your 10-day quarantine, you must go and get tested in order to be released from the quarantine. Otherwise, you're going to have to go through the whole 14 days. So if you're a contact, like a household contact to somebody that's positive, you're looking at 14 days unless you want to shorten it up to 10 and by getting tested on day 8. But you can't do it before day 8 because that doesn't count. So it has to be day 8 or after. What they're finding is that they're like a bell curve. It's like between day 5 and day 8 is when they get the most number of cases who come down with the symptoms after being exposed.
Mhm.
So that's why Massachusetts went ahead and stepped ahead, and CDC is planning on doing the same thing across the country. But right now, Massachusetts is the only one that allows you to get out of jail free with a test.
Interesting.
Yeah, very interesting. And then in terms of planning, Judy, do you think we should do any type of pre-planning for
Oh,
know,
yeah.
vaccine prep?
Jamie contacted me, Jamie Terry,
Uh-huh.
and contacted me and wanted to know when we wanted to set up an EDS drill.
Yep.
And a lot of folks are starting to do layout plans, not only for an indoor drill and plan, but also for an outdoor drive-through drill and plan as well. So, yeah, we got to sit down and either as a mini committee, 2 or 3 of us get together or something, and we got to start putting all these things together.
Yeah.
Because it still doesn't look like the vaccine is going to come out to the general population until spring.
Mm-hmm.
But there's still a lot of logistical stuff to do.
Mm-hmm.
And so my personal feeling is I don't think they're going to start vaccinating anybody in any of the hospitals. I mean, they're talking late December is the first hospital. So we're talking the other hospitals, January, February. So we're still talking March, April
Right.
before we have to press the panic button and say, oh my God, we got to put this thing together. So, but anyway, that's where we're at right now. Yes, we do need to sit down and put the plan, put something out on paper.
Yeah, I would agree. I was I watched a news article about, whatever, Framingham, Westboro, somewhere. And it was their fire department and EMTs were starting this like planning for vaccines. I was like, what? What about the health department? It was like the weirdest
Yeah.
thing. Yeah.
But that's the thing is the health departments are in charge. So, and the pharmacies are trying to gear up too. And yet we don't really have solid plans coming down from DPH at all.
Right.
If the questions have been asked multiple times over, what are your plans? Where are we going with all this? And they're still trying to put it all together themselves. So,
Right. Well, you have the most knowledge out of any of us. If you wanted to like put together a framework for like, 3 of us working together, and Mallory, if we could set up like a weekly meeting to touch base, even if it's a half an hour, to like
Yep.
move it forward a half an hour a week.
Yep.
I'd be happy to help with that and be on that.
okay. And I figured I'd draft Colleen.
She's not here, so we'll volunteer her.
Yeah.
That was the standing order on the planning board. If you missed the meeting, you were in charge of the next subcommittee.
Perfect.
Perfect. Yeah. And I'd also sent a note to Kathy and had said that some of your supplies left over from 2009 H1N1 are in the emergency management trailer down by the highway. So we've kind of inventoried, the CERT team has kind of inventoried some of that because it's sitting in the middle of our stuff.
Mhm.
So we have a kind of an idea of what's down there. We found at the Board of Health radios the other day.
Oh, cool.
Now, yeah, but you have to think, I mean, this is what, 15 years ago?
Oh, wow. Yeah.
You know? So anyway,
New batteries right now.
so we'll have to go down and look at it all. And I know the clerical stuff like pens, paper, all that stuff is good. It's been in a plastic box. It's been on a shelf, so it's good. And there's some other supplies like Band-Aids, first aid kits, things like that. So we have to go through all that.
And we just had new radios, right, Kathy,
Yeah.
that were purchased?
Yeah.
Yeah.
So if we have more radios that are in the CERT trailer, maybe they need to go in the building. Maybe they should stay in the CERT trailer.
Well, we have somebody on the CERT team looking at it. And, you know, he's a radio geek. And I'm sure he'll come back with all kinds of recommendations and everything else. Sometimes we have to rein in his enthusiasm, but he definitely knows what he's talking about. So we'll take a look at that and let you know.
Okay,
And the other thing that we need to include in on the EDS is the CERT team. So I was wondering about maybe bringing in a couple of members from the CERT team to work on the plans as well, because they're going to be part of this whole thing.
Yeah, I would think so. And I would also think that, you know, as the plan evolves and it gets, you know, a framework to then roll it out to the police and fire chief and, you know, Ryan, and review it with all of them so that they have
Yep.
input.
Yeah.
So Mallory, could you coordinate that maybe and pick a date? It's
Absolutely.
not technically a public meeting, is it? It's just like a committee.
Committee.
I'm asking. I'm asking the group. Do we need to
Yes.
public? Do we need to keep it open to the public or no?
Yes, you have to notice every meeting.
Okay.
yeah, if you have 3 or more board members, I think you're right, Van.
All right. Fun. Anything else on COVID before we move on?
I think we should compliment and thank the Council on Aging for postponing their event that they were planning. We used a lot of wisdom in making that decision.
Yeah, I agree. It was a little bit risky, and I'm glad that they kind of pulled back on that.
I was very firm with them on the phone. So I'm glad they decided to.
We'll give them the credit, Kathy, so that
They
they,
did good by making a wise decision. Yes, they
Yes.
did.
Anything else? All right. Hearing nothing, I'll move on to the nursing report. Do we have anything from MPHN this week, Mallory?
No, I haven't heard from Sandy since our last meeting.
Field systems awaiting action
No failed systems came in. No new
Alright.
ones.
and no pass failed Title V.
Mm-hmm.
So we have one permit to be voted on, installer permit for, was it Dig In Deep LLC?
So they
Go ahead, Mallory.
oh, sorry. So this is a new installer to town. They're actually looking to do 19 Mount Jeff, which is our Title V loan request that we have been kind of just tabling because they were unsure of who they wanted to do install the system. So along with their application, they included their licensing from the 2 other towns as requested. So they are in Rutland and in Spencer licensed, as well as other towns, but they're from Paxton, no taxes owed.
I make a motion that we approve their permit.
I'll second that.
Okay. Judy?
Yep, I'm fine.
All right. Vin?
Yes,
Kathy?
Yes,
And Kate is a yes. All right, so approved. And then, sorry, I'm bouncing around. We're moving on to open repairs and inspections and plans and review. Kathy and Mallory, do you guys want to just review them from the top?
So I think that, I don't think we've had any changes in our open repairs or inspections. The list has remained the same since our last meeting. I think you have a couple new ones to add to the perks though, Kathy.
yeah.
Did you get to do 69 today?
So there's no changes in the open repairs inspections, but to go on to the perks, the 3 parcels on Ragged Hill Road were done last week and they all passed. 18 New Westminster Road, again, awaiting plans. Lot 92 waiting plans, yes. 56 Gardner Road, the perk passed by squeaking through today. I was at, also, the same company did 69 Gardner Road. And so between the two perks today, I was out of the house from 10 until 4:15. But they both passed. Both 56 Gardner Road and 69 Gardner Road are businesses that will be involved in the cannabis business. Two different companies. That's
Any
all I
member of the-
have.
All right. Ben or Judy, any questions?
Mm.
Okay. Moving on to open complaints.
I have nothing new on either of them. So I haven't had a chance to drive by 111 to see the progress that they made with the dumpster.
There is no dumpster yet.
None. Oh,
No dumpster.
I'll call him tomorrow.
I did not see one this week, last week.
Okay.
So what are the next steps on those?
We would have to issue, well, we could issue fines, or we could issue him a second warning letter, or
Have we sent a second warning letter to 248 Gardner Road as well?
I don't think anyone's gotten a second warning letter yet. We were, because everyone was kind of working with us, or so they said.
On 248, I would just hold off on the second. I think it will need to be sent, but I'd like to climb the hill one more time before we send it.
Okay.
Is there any
We'll hold off
response
on
from the
111
building?
Gardner as well. Give them an equal amount of chance.
Okay. No, Vin, I haven't gotten any response, but the planning board is planning on drafting a letter as well to the CEO. So I was gonna ask that when we, thank you for reminding me. So the planning board is planning on drafting a letter. I don't know if the Board of Health wants to draft a letter to the zoning enforcement officer stating our concerns with the unregistered vehicles, the junkyard, and the commercial business. Might be better than just requesting it.
At 248, do we have an exact number and kind and a car and all that other stuff that is not registered that's sitting on that? Because that's one piece I haven't addressed. I've just been going to the top of the hill and
Yeah.
checking out the trash and crawling all over, stone walls and stuff like that. So,
Don't think anyone's ever gone down and taken inventory from, I think I forwarded everyone all the police reports a few meetings back. And it looks like at one point the police were kind of taking a stance on it too, but nothing ever came of it. So that would probably be something that needs to be done, an inventory of the vehicles and what's registered and what's not and who owns what.
I did send another email to Craig asking for an update from him, and I'm waiting for him to come back to me. So I'm still monitoring it. I noticed this past weekend that they were all lined up nice in a row. And then yesterday I drove by it and they were all over the place. So I don't know what's going on up there. So that's why I dropped an email to Craig, and I'm just waiting for him to get back to me.
Okay.
And what does the board think in terms of drafting a letter to the planning board?
It would be to the
Zoning
zoning
enforcement.
enforcement
Yeah.
officer.
Sorry.
Yeah. No worries.
Well, in terms of our purview from the Board of Health, I think we not only have the trash, but we also should have some kind of concern with hazardous waste that may be leaking or thrown away in the yard. And it is in the oh, come on, the,
Watershed,
not the watershed, but the aquifer
Robin,
protection area,
Aquifer.
aquifer. So, I mean, there's some multiple issues that cross over between us and the zoning enforcement officer, namely the junkyard and any type of leakage of hazardous wastes, the aquifer protection area, and the way we look at the aquifer protection with any hazardous waste that may be coming out, the trash, and probably some type of maybe vermin that may be living up there because of the situation. So, there's a
Well-
lot of cross issues that if we
The
all
only
work
problem
together-
with all of that is you need absolute proof, and right now we don't have that.
Well, I realize that, Judy, but I mean, obviously, we're in the process of looking at it and investigating it, and those are the
Right.
issues that we need to ascertain exist or don't exist. But like I said, they cross with the planning board's concerns as well as the zoning enforcement officer's concerns. So I don't see how we would go wrong by cooperating with everybody.
Yeah, I would agree, especially if in the context of letter, we actually, ask to pool information and resources so we have one consistent file on, the properties.
Definitely.
Anybody
Alright.
else want to weigh in on that, Kathy? Or
Mallory, maybe when you see one of the building inspectors, they could ask them whether or not they feel competent in determining whether or not there are hazardous wastes leaking from the cars or being disposed of.
Sure.
That would be something that we would be able to ascertain, and maybe we need to be in the inspection with them to see if there's anything in that
Okay.
respect. But if they can identify it, then, we don't have to go with them, but it looks to me like it's gonna be a pretty big issue.
Hmm.
Okey-doke. And Kathy, do you have any input on how do you want that letter to read, or do you have anything else to add?
Well, if we don't have the proof right now, other than the trash issue in regards to the vehicles, the number of vehicles, probably should hold off. Mallory, when is the planning board intending to send this letter to the zoning?
I am not 100% sure what their intention is. I know that the chair was working on drafting something to present to the board that would go to the CEO.
All right. Well, Judy asked that we give them a little bit more time, so I guess I would ask that we table our decision to the next meeting.
Okay.
Okay. Any other conversation on this topic before we move on? All right, moving on to new business.
We gotta move on, act on that motion.
Oh, sorry. There was a motion. A little tired. Yeah, want to formalize that motion, Kathy?
Make a motion that we table a decision on second, what do you call them, complaint letters, second complaint letters to both 248 and 111 Gardner Road until the next meeting,
Okay, do we have a second on that?
sent out.
I'll second it.
All right. All in favor? Ben,
No,
Kathy,
Yes.
Judy,
Yes.
and Kate? I'm actually a no on this one. I think I personally think while we should wait for the second letter of enforcement to the individuals concerned, I think that we should reach out to the other boards so that we have whatever information they have. So we're working towards getting more information in the interim.
Okay, I'm all right with that.
All right. So motion as adjusted? Or do we need to make a new motion?
well, the motion to table fails, so there would be a new motion to write a letter, or go along with the letter.
All right, so I make a motion that we write a letter to the Planning and Zoning Enforcement Boards requesting any information that they have on these two properties. And we delay sending any kind of second letter of warning to the two property owners until the next meeting.
That sounds better, Kate. Thank you. I second that.
All right. All in favor of Vin,
Yes,
Judy,
Yep.
Kathy,
Yes.
and Kate is a yes. All right. Mallory, you got all that?
Yes.
All right.
Lots of scribbles.
I know. And let's see. Going back to the agenda, we're going to move into new business Title V loan request.
So we have 19 Mount Jefferson Road. They have I've sent over the application and all their supporting documents as well. We have plans that are approved by Matt. They actually got 4 estimates for installation. They're finding that a lot of septic companies are unable to move as fast as they want on getting the system installed. They're actually looking to sell their home. So they're looking to take the loan out and then pay it back with proceeds from the sale of their house as soon as possible, as soon as the sale goes through. So they did contract with Dig In Deep. That's who they chose. They're asking to lend from our Title V program a total of $24,380. They're going to pay all permit fees out of pocket and all fees to get this recorded at the Registry of Deeds out of pocket as well. So that's where we are. And I guess we just need a motion, and then if it's approved, we move forward and get the paperwork taken care of for them.
So the total is 25,000 is written in the permit, right?
Yeah, they wrote 25,000 in the permit, and then they got this new estimate. So she actually called me yesterday and told me that she's only going to need the 24,380 that is on the proposal from Dig In Deep.
so if they are going to be using this money in order to fix the system so that they can then sell their house, are we going to attach the mortgage or the deed rather? And if so, who's gonna prepare the attachment? Okay,
Good
I'm
question.
sorry, Vin, you froze. I couldn't hear what you were saying.
okay,
Or I froze.
can you hear me now?
Yeah, I can hear you now.
If they're going to borrow this money in order to repair their system, in order to sell their home, which is fine,
Mhm.
are we going to attach their deed? And if so, who's drawing up the attachment? And
Our treasurer collector,
say that again, please?
the treasurer collector. She's
Oh,
in
the
charge.
treasurer collector. Okay.
Yeah, I give her the approval, this is good to go, we voted on it, then it's her job to figure out the loan. She'll have to figure out the payback amount, because it's 5% interest on the loan that'll have to be paid back, and that will go right into the general fund. And she'll handle pretty much everything once we say it's approved.
So she'll handle the attachment, however, that's my concern.
Yeah, the town is responsible for recording it.
Okay, good.
Yeah, so that's how we make sure it gets done. And then actually we require a check from the applicant to release it as well. But we handle the filing, they just pay for it.
Wonderful. Okay,
Gotcha. And then, and the amount again was 24?
$24,380.
Well, that's not on any of the paperwork.
Yeah, I was gonna say, I would like the paperwork amended so that it's clear and we have a clear
Okay.
paper trail.
Sure.
I only see 20,000, so I would not be inclined to vote for anything more than 20,000.
Well, I
Okay.
see 25,000, Kathy, on
That's
the,
not
There, wait a
25.
minute, never mind.
yeah.
That was the contractor estimate, yeah.
So then, yeah, I'll just ask her to just give us an updated application then.
Yeah, even if that page is just
Yeah,
rewritten.
it's not a difficult one.
Yeah.
Okay. Easy enough.
And do they have is there like a timeline on this for is us delaying to the next meeting gonna cause grief to the homeowner or anything here?
I think that they were looking to move as soon as possible. So I don't know if there's a date inside. It said they recommend waiting till spring to rake and seed as grass will not grow, blah, blah, blah. But it doesn't have like a start date. So I know obviously if it's holding up a sale, but I mean, I agree with having I didn't even pick up on that when she submitted the new estimate. So
Okay. Yeah, I just like to have a nice clean paper trail before you vote on it.
definitely, I agree.
Okay.
Yeah,
Everybody happy with that?
I'm happy with the waiting.
Also,
All right.
Sounds good.
And then 10 Main Street?
So they're just moving along in progress. I haven't gotten any information. I haven't gotten anything back from the treasurer collector with any problems. So I don't know where they are, but
You're, we cannot hear you, Mel.
forget it.
We missed all of that.
Of course. So there's no real update right now.
Okay.
We haven't, yeah, it's just
It's status quo on 10 Main Street.
thank you.
All right. Health inspector?
So I actually put this in twice by accident, but we did publicize for the posting for Kathy. As of yet, we haven't been out for a week. We have not gotten anything other than the one, I'm sorry, that kind of came forward before we even posted. So Ryan's gonna give it a few more weeks and then put it in again and see if we can't drum up some more interested candidates. So if you have any friends, tell your friends.
Friendly neighborhood health inspector.
Yes, please.
And then holiday fair?
So we pretty much touched on that already. They decided to cancel. They're still going to be selling their swags and their cemetery boxes, but they're doing a drive-up service and are working in conjunction with the gingerbread fair, which is going to be all pickup and pre-ordering. So they can't have it the way they want it, but they found other ways to get creative. And yeah.
Cool. I wonder if,
Yeah.
if they did like an eBay online auction.
So that's actually another thing is, so I guess at these fairs, they usually do tons of baskets that they raffle off. And a lot of them are already pre-made. So Claudia was a little disheartened about not being able to do the raffles, but the town clerk and I have offered our services to do like a virtual live thing where she can still sell tickets, and it's not going to be the you bid on what you want, but kind of you get your number pulled and you get whatever basket is pulled for, I think. So they're still working out the details, but we're still trying to get it so that those don't go to waste, because she has already put together over 20 baskets and they're beautiful. So we're working on that part.
Cool.
But a lot of places are doing some cool virtual stuff.
Yep. I had another friend who's planning a virtual what's it called, blind auction, but they're doing it using just eBay. So they're setting it up and letting people put in bids, and highest bid takes it.
That's cool.
Yep, which is kind of fun.
Yeah, if anything that has come from this pandemic, we've definitely tapped into our creativity.
Yep, if we're all going to watch the Trans-Siberian Orchestra on Zoom, I think we can do anything.
Absolutely.
All right. Viewpoint permitting.
Yep. So this is the new permitting system that the building department has implemented for all building, electrical, plumbing, and gas permits, as well as inspection requests. So in the past, when there was a new building permit that came forward, I guess there was I don't know if Patty had a sign-off sheet or whatnot. We had that form that was kind of filled out that was attached to the building department, but we need to find a new way to get the sign off from the Board of Health. So what I need to do is I need to set up someone with an account on Viewpoint, so that when a new building permit application comes in, someone from the Board of Health can sign off saying that Board of Health is good to go on it. And all that entails is clicking off a complete button or making a comment in the file. So it's super user friendly. I just can't be the person who's doing it because it's way above me and it's a huge liability if I do it. So I guess I'm just looking for a volunteer to be that person.
Once the account is set up, can it be transferred? I mean, I'm assuming it
Oh
can,
yeah,
right?
yeah. And it's on a cloud, so it's not like anything's attached to your computer. What happens is you'll get an email that says so and so has a new document to review, and you just literally go in and take a look, review it, make sure that we have the approved plans on file. If they're doing something like adding a bedroom, we need to make sure, which I kind of do anyway before, so we get a permit. But
I'll do that if nobody else wants to do it.
thank you, Ben.
Well, and I think Ben, it makes sense. It's kind of like in your wheelhouse. And
Try.
Well, then I'll get that invitation out to you. It'll just come from Viewpoint Permitting, and it's also called Open Government. So I don't know what the email will look like. Do you want me to send it to your personal, or do you want to use the Board of Health email, or?
No, the personal's better.
Yeah.
That's fine.
Okay. And if you need to come in and have me walk you through it a few times, I'm more than happy to do so.
Wonderful. I can do that.
All right.
all right. So the next topic is my topic. It's about the Board of Health assessment of fees. So I had said a couple meetings ago that I'd do some research. Mallory forwarded 2 sets of documents to the board to review. One is the legal regulations, laws and regulations for Mass Board of Health, and there's some reference to it on page 5. The other one is interesting. It's from Northampton, Massachusetts, and it's a document that they put together to outline permitting fees and authority of the Board of Health. So I found this document, I read through it, and I cross-referenced back to the Mass General laws and the specific laws that govern the Board of Health, and it seemed very valid. And then to double check, I asked Ryan, I said, what's the authority of the Board of Health to change fees, to set permit rates, and to, review or increase them over time? And he said, you guys pretty much do whatever you want. And I asked specifically about town bylaws and anything in the Board of Selectmen, the laws that govern the town charter, all of it. I reviewed them. I couldn't find anything. And Ryan agreed. He said, nope, there is nothing. The Board of Health is basically allowed to set permit fees and set licensing fees to cover the administrative costs of the services offered. Some of them are obviously restricted, like for example, Title V fees are based on the state, and the policies around certain things are based on the state policy. And if you vary from them widely, you have to actually get authority approval from the state and the Department of Environmental Protection. With regular permitting, that's not the case. So if you haven't had a chance to read everything, I'd ask that you guys read it and review it, and then we can ask questions about it later. I don't know if you've all had a chance to read it.
What
You
have,
said you-
yeah, what have gotten out last week?
Would have gone. I missed it. Sorry.
Okay.
That's okay. Would you like me to re-forward it?
Yes, please. For me.
Okay.
That wasn't
Yeah,
around.
I'll
so-
need it forwarded as well.
Okay, so and then everybody take a chance that as you have a chance, read those 2 documents or the reference points. In the Board of Health laws and regulations, it was page 5 specifically that I found interesting and relevant to the Northampton document. But it was funny because when I asked Ryan the question, he said, no, there isn't anything in the bylaws or the charter that regulates the Board of Health in terms of setting permits and fees. And then this document put together, he actually forwarded me this document and I said, yep, I already found that one. The case law is actually interesting too. I looked at some of the case law referenced in the document from Northampton, and it's very specific that in every case, it was found and supported that the Board of Health is allowed to set the fees, period. So we have quite a bit of leeway. I'm not saying that we should review fees and set them arbitrarily or set them unnecessarily high. I just think that we should review our fees relative to other towns and make sure that we're competitive and make sure that the fees and permit fees we're charging make sense, aren't excessive, and also, make the process easy. So as an example, if we have a process where somebody goes through a permitting process and pays a fee to then pay another fee, I think we should look at that and try to streamline it. Even if it just means they pay a fee once and then the process is combined or something. But I think it's a chance to review the fees and permits, make them competitive, and make sure we're covering our costs, especially as we're looking at bringing in third-party agents.
Definitely. And Kate, I don't even know why I didn't think of it. I just glanced out of the corner of my eye. I have a legal handbook for Massachusetts Boards of Health from MHAB. It's 2011 edition from when I started with the Board of Health, but there's a whole chapter on the regulation of fees and our rights as a Board of Health. And as you were talking, I just kind of glanced over on my bookshelf and saw the binding of it. So what I'll do tomorrow is I'll take apart the book and scan that portion as well, because there's a ton of case studies in it, and it might spark something else we want to look into. So,
Yep. And I think, so the next step on this is we'll just discuss it at the next meeting and go through questions. And then what I'd like to do after that, if everybody's in agreement, is, kind of set up a separate mini committee, or, have two members of the board review the fees with Mallory and say, this is what we recommend. So that's my thought process. I don't know if you guys have a different way to approach it, or you want to approach it with a different framework. That's fine too.
Sounds good.
yeah, I like
I
that,
think it sounds good, Kate.
because we're definitely missing out on some opportunities too, like our Title V review fees. So,
Well, and all good things must change eventually, right?
you got it.
All right. So going back to the agenda, EDS drill.
Kind of already went over that. So
There's a drill coming. That's what we've
it's a
heard.
coming.
It's coming. All right. Old business. We have food inspections. We did one.
The center school was inspected last week.
Yep.
Very clean. No problems, right, Kate?
No, it was.
Beautiful facility.
I have to say, overall, I've been really impressed with the people in our town and how meticulous they are about the kitchens. Even Rieta, I was like, this is immaculately clean. I was shocked.
That's awesome.
I always expect the worst. I'm such a negative person. But yeah, and the school obviously was super clean, well organized, everything documented. It was really, really good.
Was the Capri goat cheese place, were they inspected this year?
Nope, not as of yet.
Okay. So
Westfield
that's
Farm.
the last big one that I know of. We'll have to work it out, Kate.
Yep, that one's usually pretty straightforward as well, because it's only the food prep areas that are inspected.
Correct.
And I've actually done that one before. I'll try to find some time and call them, because I do that.
Okay.
And they're not always operating.
Correct.
And next thing is the budget spreadsheet.
Mallory, thank you for the turnover sheet. I did look at it. I don't know that there was anything else. She sent in a separate email today.
Yep.
So no bills were paid. It was just a turnover.
Okay.
Very good. And sorry, I'm jumping back and forth on tabs here. The EDS plan.
I don't know if Judy had anything to update, so I'm just kind of keeping it on here until we have a hard copy binder in our office and we're good to go.
Yep, I'll get to see if I can, I've been writing grants, so I really kind of just shoved that to the side.
Understandably so.
All right, and health inspector, we had already covered in the previous topic.
Yeah.
It's duplicated. So any unexpected subjects or things people need to discuss?
I have an afterthought, if I could interject this one. We now have, I think Kathy said 8, or maybe Judy said 8 or 10 cases of of the COVID?
We have eight confirmed and 4 probable
All
that
right.
are active at this time.
active.
Okay.
Yeah.
Can we identify an event that may have taken place? Perhaps Halloween, or are these just random cases that have occurred?
Totally random.
Okay,
I am sending out an email, which Ryan is putting on social media towards the end of each week now. With
Say
the
that
current
again?
numbers. The only other new business I have is, it's on the list of papers that Mallory scanned for the Unitarian Church for their
Oh.
Christmas plan. If you all take a quick look at it, go down through the documents. They're doing all curbside sales.
Yeah, I don't know if I have that. I'm looking in my email.
I didn't see any problem with it. It's basically a drive-through.
Correct. And they're going to keep a record of who has volunteered. They're going to have a list that, you know, if something came up, we'll know how to reach the people that were involved. So I guess I'm going to make a motion that we approve the First Parish Unitarian Church Holiday Gingerbread Fair Plan that was been presented to us.
Second the motion?
Okay. All in favor? Judy,
Yep, it's fine.
Ben,
Yes.
Kathy,
Yes.
and Kate is a yes. Motion passes.
Mallory, would you reach out to her to let her know?
Sure.
Thank you.
You're welcome. That was Carol Whitney, correct?
Yes.
Okay. And then I just had one unexpected item myself. We got a call from Christopher Burnham on he's at 65 Old Boston Turnpike. We kind of talked about 55 Old Boston Turnpike before. It's a parcel of land that's in a trustee name. There's 3 family members and there's a family feud going on. I guess one of the David Dakota, who lives at 55 Old Boston Turnpike, told number 65 Old Boston Turnpike that someone had installed, his sister had installed a septic illegally, and that she put a pipe running through onto his property, and that Kathy was coming down to inspect. So I told the abutter that we inspect new installs and repairs, but a septic system isn't something that we can just see with our blind eye. It would have to be dug up for us to see something like a pipe running through the ground, like he explained to this occupant of 65, Christopher. So I wanted to ask Kathy if you had gotten any phone calls or if there was something I was missing. It sounds like there's a lot of storytelling going on. That, like I said, there's a family feud. Police have been involved. Taxes aren't being paid, and the property has been taken for tax title. And so there's been quite the amount of chaos going on there. So I didn't know if someone had reached out to you personally or what was going on, but I said I'd bring it to the meeting and I'd give them a call back to let them know.
And
So,
who's the
no,
person?
no, I have not.
Okay.
Phone calls, text messages, or emails from anyone.
What was the name of the party, Mallory?
55 Old Boston Turnpike. It's Dakota. is the last name. It's a trustee. That's an estate. So there's 3 houses on this estate. This is the one with the dog kennel
Mhm.
on it. So David Dakota is feeding with his sister who owns the kennels. And he advised his abutter at 65, Christopher Burnham, that at some point in time, no one knows when, no one knows how long ago, an illegal system was laid down and that the pipe runs from 55 into 65. And he was told that he told a butter or neighbor that Kathy was going to come and make him dig it up and inspect it.
Nope,
We-
nobody impacted me whatsoever.
And that's, I mean, if it was installed, if someone crossed
And I wouldn't
trespass,
say
that,
that anyways.
right, that wouldn't be something we inspect, and that would be civil. Nothing that the Board of Health can, that would be trespassing at that point. It's kind of the same as, dumping trash on someone else's property. So he was a little confused. I think we all were.
Yeah, that's a civil issue. We should not be involved.
I would agree with that.
He was just more upset about the fact that someone might be coming out onto his property without being made aware. And I advised him that we would always make him aware before there was an inspection done. So he was good, but I told him I would follow up and make sure that nothing had transpired, between you and someone else, Kathy, and that we're all good to go.
I think you advised him well.
It's been a strange week. It's only Tuesday.
Only Tuesday.
Only Tuesday.
I know. All right. Any other unexpected subjects? Things to discuss? All right. Hearing none.
Move
Take
to
a motion.
adjourn.
I was waiting for you, Vin. Thanks for being my hero. I'll second that.
It's the only motion that's always in order.
Right? And everybody always agrees.
I agree. And second.